It is now my pleasure to introduce our keynote speaker, Dr. Linda Scheirton. For more than a decade at Creighton University, Dr. Linda Scheirton has been assisting students with disabilities in achieving equal access to educational experiences and acquiring reasonable accommodations to ensure adequate preparation in their discipline. In the past, she has served as the Associate Dean for Academic Affairs in the School of Pharmacy and Health Professions. She was the chairperson of Special Needs and Assessment Committee, SNAC, and she was faculty moderator to the Student Empowerment Network. She is also a faculty associate in the Center for Health Policy and Ethics and teaches ethics-related courses to doctoral students in the Occupational Therapy program and in the Interdisciplinary Doctorate in Leadership program. Disability ethics is one of her interests. Please give a warm welcome to Dr. Linda Scheirton.
Well, thank you, everyone. It's great to see you here, and I'm excited that we also have some students in the audience. Thank you for coming. Great. Accommodating students in the classroom is very important. I think that we do a very good job here at Creighton University in allowing students to have an opportunity to compete on a level playing field. I think that's the term that I want to use.
The objectives that we're going to discuss is to look at the two federal laws, and I know most of you in this room today are aware of the protections for students with disabilities, but I would like to mention the two federal laws. I would like to list some types of disabilities, some typical ones that we will run across as educators, ones that we would be looking at for giving accommodations. We're going to discuss some mechanisms to determine what is a reasonable accommodation for different types of student disabilities, because sometimes the accommodations are quite reasonable and other times it is quite a burden to be able to give those accommodations. So what is reasonable and how do we define that? And then I'm going to discuss some best practices to facilitate student learning and success. The two federal laws that protect people is the ADA, the American with Disabilities Act, which came about in 1990, and then more recently in 2008, we had amendments to the ADA, the ADAAA now. The amendment essentially expanded some of the protections. There were some cases, Congress, there were some different issues that were going on that started putting some restrictions, and it was felt that there needed to be some amendments to the American with Disabilities Act to expand some protections. And then the Rehabilitation Act of 1973, Section 504. So these are the two main areas that we refer to. For ADA, if you define a person with a disability, it's someone who has a physical or a mental impairment that substantially limits one or more of the major life activities, or has a record of having such an impairment, or is regarded as having that impairment. Now here is a list, and it's not exhaustive, but here is a list of some typical disabilities that we see here at Creighton University. Now more than ever, you're seeing more students in higher education from the autism spectrum disorder. These students are high-functioning students, and they certainly need accommodations. You have students with acquired brain injuries. ADD, ADHD is probably one of the largest number. Learning disabilities, blindness or visual impairments, epilepsy, deafness, hearing impairments, mobility, whether that be with crutches, wheelchairs, etc. Chronic illnesses. I think Creighton University was one of the first universities When we first learned about AIDS and HIV, we had a dental student with HIV who was accommodated and was able to continue his education. Cancers, diabetes, fibromyalgia, muscular dystrophy. Another large area is psychological disorders, and we've even had students with, organ transplants. You don't think that you would have that many, but we have. I remember one time a student being concerned because one of our students was parking in the handicap parking, and they weren't limping, and they were not, didn't seem like they needed to have a handicap parking permit. And I reminded the students that sometimes, students do have handicap parking permits for a number of reasons, and that if they had one, it was legitimate, and it just so happened that person had had an organ transplant. And so at the time, there was not a lot of stamina, and it was very hard for that person to walk. And so that's why the person had a temporary handicap parking, not a permanent one, and I'm sure now the person does not even need to have one. Learning disabilities, the National Joint Committee on Learning Disabilities define a learning disability as significant difficulty in the acquisition of use of listening, for example, speaking, reading. I like to use have you heard of the book that just came out about the Manuel brothers? Ezekiel Manuel is a bioethicist. His brother used to be in the Obama administration, and now Mr. Emanuel is the mayor of Chicago. And then his other brother is a high-powered talent agent in Hollywood. So these three brothers have done phenomenal things in their lives. And two of the brothers grew up with dyslexia. So it should not hinder. There should be ways that people can be very successful and still have a disability, and there are. And these are three brothers that have been quite successful. Learning disabilities such as writing, reasoning or mathematical abilities, dyscalculia. One of the things that sometimes you run across, and you may have a student who has problems with writing. In the School of Pharmacy and Health Professions in the past, we've had a couple of students who had a real problem with writing, and sometimes that can be a real handicap to them, especially if they're writing in medical charts or if they work in some high-powered business where handwriting and other people see their handwriting is important, if they're going to be building a bridge and they need to have handwriting that can be read in the construction business. So there's many, many reasons to have, but if you have this disability, how do you deal with it? Are there assistive devices to help you? So that maybe you can print things out and put them in a record or put them in a patient chart when you cannot read the handwriting. It sounds like a simple thing, but it can be quite difficult for people if they cannot write and you cannot read it. Also with learning disabilities, since it's an area that we see a lot, is that with learning disabilities sometimes there's information processing issues. And I know that Dr. Grandy has done a lot of testing in this area with students. Psychological disorders, depressive, bipolar, anxiety disorder. This is something that happens quite a bit. Panic disorder, social anxiety disorder. Test anxiety can be very crippling, and we'll talk about that in a few minutes. Obsessive compulsive disorder, post-traumatic stress, eating disorders. Here at Creighton University in health services and counseling and health services, they have an eating disorder treatment team that treat and monitor students with anorexia and bulimia. We know that if we have a person that is suffering from this, and if we catch the issue early, and if they get treatment, and if they're monitored, that the success rate of them not continuing with purging or binging, it's likely to stop if you catch it early. So I'm very pleased to know that, Creighton has a special team, a treatment team to work with these students. Sleep disorders, hypersomnia, narcolepsy. What happens when you have a student with narcolepsy has a problem getting up? What if they have to take medication, and that medication, it takes a while to kick in the morning? What accommodations can it be, can you have to possibly have them have later classes? Or what accommodations can you make on a clinical site? What about housing? What if they're doing some kind of internship with the business school and they need to be close to some certain business so that they can get up and be there, and it won't be a danger of driving and hurting themselves or hurting someone else on the road because of their narcolepsy until their medication kicks in the morning. We have some pharmacists here. They can probably give us more insight on how that works. Delayed sleep phase disorder. It's often misdiagnosed that it's a psychiatric problem or it's insomnia. We have had students who have trouble waking. They may have some of these special high-powered alarm clocks, and it may take even the kind that you put in the bed that shakes the bed in the morning to try to wake them up, and they can't wake up. And this is a real hindrance if you have to be at class on time, and if you have a report. And so, how do you work with these students? What assistive devices can you work with them? Sometimes this may end up being sleep apnea and maybe being diagnosed correctly. And so sometimes it takes a while. In the meantime, the student may not be performing well because of some of these issues. Well, what are our obligations here at Creighton under ADA and under Section 504? Well, the university should provide reasonable modifications or accommodations to ensure that the programs and the activities are fully accessible to the students with disabilities. However, CU is not required to fundamentally alter the essential character of these offerings or to provide any modification that would result in an undue burden. So, for example, I grew up in Texas, and I love the sun, and sometimes in the winter I get a little blue. And have a problem sometimes with seasonal affective disorder. It's fine if I have a window. Well, for many years I was in the basement of the Boyne, and so I would use a light, a broad spectrum light, for about 30 minutes, and I would be fine. When I moved up to an office where there was a window, no problem at all. Now I'm back in a basement again. So what do I do? Well, either use a light, or you can go to the library and do some work by the window. You can, if you're a faculty member and not an administrator, sometimes you can even go home and do your work. Administrators can't. They have to come at 6 in the morning and leave at 6 at night, but faculty members have a little bit more flexibility. So you can go home and sit by the window. But would it be appropriate to say, if I went to John Pierce, for example, or Wade Pearson, and said, I want you to put broad spectrum lights in every classroom, every building that I go to a meeting? Well, of course, that would be unreasonable. You couldn't ask that. Now, can I ask for them to put broad spectrum lights in my office? Yes. The bulb cost about maybe an extra $15, so it's not a big expense. If they put in all those bulbs in my office, the total cost is about $15 extra. So it's not unreasonable for them to do that for me. So I think that's a good example. So reasons for accommodations. ADA permits people of similar intelligence and potential to compete more fairly. We want these students to be able to achieve, and so that's the reason why we give these accommodations. It levels the playing field for both those with physical disabilities and those with brains that function differently. Learning disabilities is, like I said, one of the number one groups of students asking for accommodation. The odds are that 2 out of every 100 students have a learning disability. One of the things that sometimes will help is to have a reduced course load, but this is not always possible in certain lockstep programs such as medical school, occupational therapy. I would assume also pharmacy. It's very, very difficult in some of these lockstep programs there's only one course offered one semester by one instructor. It's not like having in the undergraduate setting where you may have 3 or 4 sections and to be able to take. So there is some limitations there. However, extended time to complete assignments, extended times for taking exams, quiet areas, having a quiet area, a separate area without distractions. Sometimes even allowing for an oral essay rather than a written. Audio textbooks, a reader, class notes, speller checkers, for example. If you have issues with spelling, you can certainly have a speller checker available during an exam. The mobility impairment accommodations. This is something that I'm very proud of from our student group, the Student Empowerment Network, because they have, for more than a decade as well, been involved at looking at access issues here on campus, bringing it to the attention of the ADA committee, bringing it to the attention of the president, bringing it to the attention of faculty and staff. And they have made a lot of changes here on campus based upon this group doing their annual assessment on campus. So I'm very proud of their work. Accessible campus and buildings and parking is very important. Students who have mobility impairment need to have accessible campus parking. They need to have readily available to get into the buildings. If you have to go through a labyrinth to get into a building, that's not very accessible. And so I think that we've made a lot of changes here on campus to accommodate, but we still have a ways to go, as always. Extra time to get to one classroom to another. Now, this is very, very difficult, I think, for some programs that are lockstep, because you have a class every time in between. You only have about 10 minutes. And so this is a problem for some. So if a student comes into the classroom late because it takes them longer, then this has to be accommodated, and possibly giving information to the student that they missed because they could not maneuver, whether by walking or by a wheelchair, could not get there in time. Special seating in the classroom, note takers, recordings, adjustable lab tables. I know that some of our labs have some accessible lower tables for mobility impairment, special computer equipment, rest accommodations. Blindness, visual impairment, accommodations can include giving the student reading lists ahead of time and the syllabi in advance to permit time to be transferred into alternate format. And I know our librarian is here and will be discussing the optical character recognition, OCR, screen readers, the different assistive devices that are available for students that have blindness or visual impairment. Recordings of lecture and discussion, textbook and handouts in the medium the student prefers, whether it's recorded, which means you have to have advance time. You have to go to those instructors ahead of time, find out what they're using. Now, this can be difficult if you happen to be an instructor that waits the last minute to put their syllabi together and put their course readings together, because this does not give the student enough time to have the materials recorded, for example. And so the disability office works very closely with the faculty to get this stuff early, because it's really a detriment to the student if they don't get it on time. And so that's important, and I think that's something that faculty need to realize about preparing ahead of time to give this time to be put into Braille or to enlarge the print. Also, clear black print on white. You notice my slides today, it's nice to have white with black. Sometimes we get hung up with a lot of color, which is very stimulating to a lot of students, but if there's lots of shades of color on your slides, then if a person has a visual impairment. Now, I have probably broken the rule very much by putting too much on the slide, so I will qualify that, but indeed trying to use print that they can see easily. Testing, you might tape a test, you might read a test to a visually impaired person. Assistance, again, we'll talk about that, about the Office of Disability Accommodations, what they can do, and then what the librarians can do to assist. Deafness and hearing impaired. Accommodations may include speaker facing the class during lecture, so you may want to have the student closer to the front of the room. An interpreter or an amplification system, possibly an FM loop system where they will be, the system is hooked up directly to the faculty and to them, and so they can hear directly and not have to worry about noise, outside noise. Written supplement to oral instructions, test accommodations, again, because there may be a need for extended time, separate place, access to word processing, proofreading of essay test, interpreting directions, etc. ADD and ADHD accommodations. Sometimes students become more hyperactive, I guess, as the day goes on, so it's sometimes much easier to have more concentration early in the morning when you're fresh. There's less distractions, and they're able to concentrate more if they take morning classes. So trying to work with students in their schedules to get them those accommodations. Allowing to sit in the front of the class. Converting textbooks and readings into accessible mediums, such as audio. Again, note takers, scribes. Organizing things very lockstep. Tasks needs to be broken down, schedules, and I know our academic success counselor will probably talk about some of these strategies to keep the student organized and to keep them on schedule. And again, extended time on exams in a quiet room. Now, the autism spectrum disorder is something that is fairly new for us, I think, for faculty on campus, because we have a lot of high-functioning students that are coming to campus now that need accommodations. Usually these students prefer clearly established and ordered routines, and so it's for a faculty member is sometimes you'll if you change things and you don't warn someone and you do it at the last minute, this can put someone in a tailspin because they need to have it very clearly established. There needs to be warning, and you need to prepare them that these changes are anticipated. Sometimes the students will email you more often, for example, because they need to have everything very, very clear. Written or visual is usually what is needed more so than auditory, computer use for writing, note taker, and again, extended time for exams. Psychological disorders, it seems like we're now beginning to see just a pattern, you know, extended time, when is it indicated? And so we're going to talk about that. There is a wonderful article that has been written by Benjamin Lovett talking about extended time testing accommodations for students with disability. Answers to 5 fundamental questions. What do we need to know to really determine if students should have extended time? And I think that's an area of weakness. We don't always know that. And so what happens, everyone gets extended time. And then we are concerned that maybe we're giving some students an unfair advantage because we're giving the extended time. So I think that now people are beginning to look at extended time and making sure that there are some steps that are followed to really determine if it's necessary. Because I don't think extended time is necessary for everyone because they have been diagnosed with ADD. Psychological disorders, again, the extended time for an assignment completion, for example, obsessive compulsive disorder. Students may have a hard time with getting started on an assignment. And sometimes giving them additional time can be a help. And I think Dr. Grandy can say sometimes it can be a hindrance. Is that correct? Well, we'll talk about that. So when is it appropriate for an obsessive compulsive disorder to give extended time? Sometimes it may be appropriate and sometimes it may be a hindrance. Note takers, readers, recorded videos, incompletes or late withdrawals. So if you have a student with a psychological disorder and they have a crisis, sometimes the best thing to do is to say, you know, it's probably better this semester to get treatment, get some help. We can go ahead and withdraw you at this point, and then you can come back. Or if it's toward the end of the semester and there's only a few things left in the course, you could offer an incomplete. But trying for them to limp along and then fail the whole semester and have poor academic standing and possibly probation or dismissal is not the best thing to do. So trying to consider some of these options. Instruction to use relaxation, stress reduction. I know that there are a number of people on campus and academic success counselors who are using biofeedback techniques to let students learn or to teach students how to reduce the anxiety, to calm down right before a test, to use techniques or to use assistive devices such as heart math to reduce their stress before they walk in to an exam to decrease some of the severe anxiety. One of the things about test anxiety, though, is whether a student should really have extended time. Is it really considered a mental impairment? There has to really be a diagnosis for a student to get accommodations for this, and this is not always easy to determine. Is this just a little bit of anxiety, or is this major anxiety? Is this a social phobia? Is this an anxiety that can be treated, or is this just something behavioral that we can just work on through counseling? We do know that anxiety can really change your career. I mean, if you have it and you can't take tests, there's a lot of careers that you will be excluded from. There are all kinds of credentialing, licensure, training exams that you have to pass to be able to be successful in a career. So giving a few of these accommodations may go a long way for a person to be able to have the career that they want to have. So what are some of the symptoms? Subjective distress. intense fear or apprehension, sometimes bordering on terror right before an exam. You feel dizzy, you feel tension, stomach discomfort, fear of fainting. Some physical symptoms are trembling, sweating, changes in heart rate and breathing, clammy hands, voice tremor, muscular tension, and then cognitive component. They're distracted, they can't think. You know, they started having these intrusive negative thoughts. I'm going to fail. I don't know the answer. I'm going to fail. I'm going to fail. I'm going to fail. And they can't even get past the first couple of questions to realize they do know the material, and they just had the two hardest at the very beginning, and they could have passed easily. So they have to calm down. Students sometimes go blank, and their concentration diminishes. I think we have had faculty report to us that they've had a student just collapse in front of them right by walking into the room for an exam. I've had a student in my office just absolutely trembling and perspiring. It was, you know, so this is, it does happen, and I'm sure you as a faculty member and maybe some of you students have experienced these feelings, or at least maybe a mild version of these feelings, but it can be quite crippling. Treatment or academic counseling for test anxiety is really helpful. You can certainly use drugs, but sometimes some of the beta blockers or Xanax or some of these anti-anxiety drugs can also give some cognitive impairment. So there may be some cognitive functioning that is decreased because of taking these medications. So you know, hopefully psychotherapy, behavior cognitive therapy, relaxation, stress reduction, biofeedback before an exam would be much better than taking medication, of course, if those techniques could be taught. Other disabilities, diabetes. Sometimes you have students that need permission to check their blood glucose in the classroom, the laboratory, clinical facilities. Sometimes they have to have a separate exam room or a permission to check blood glucose levels or take a break to eat. And so I know that some students go over to the testing center and they have that ability to do that. Sometimes there may have to be a permission to reschedule exam if levels are abnormal or if the student is in a confused state. And sometimes this might happen when they're not controlled. And sometimes you have a situation where the students really can be controlled, but they choose not to be controlled. Maybe they don't want to be burdened with a pump. There's certain things that they don't want to be burdened with. And so they're not controlled, and then all of a sudden they have an episode right during the test, and you have to suspend the test, or you have to start sending them over to the center, the testing center, to take the exam. Eating disorders, I talked a little bit about that, and I think that we have a really good system here, and I know Dr. Grandy will probably talk about that in our panel discussion. Case law and federal law tells us that an accommodation is not reasonable if it fundamentally alters the essential nature of a course, curriculum, or a program. And it constitutes services of a personal nature, so we're not required to give private tutoring to all students. Now, we do have tutoring on campus, but we're not required to provide a personal tutor, for example. That would result in undue burden, financial or administrative. So that's one of the things that's considered unreasonable if it's an undue burden on the institution, or if it would result in a direct threat to the health and safety of others. And so I'm going to try to give some examples. A student has a language-based learning disability. They were exempt in high school from taking a foreign language, but a foreign language waiver is denied at the university level because maybe they're in a certain discipline, a certain program that requires a foreign language, and they feel it's very important that they have this. On the other hand, an institution may perceive that foreign language is not essential to a fine arts degree, and they may decide to waive or substitute, for example. They're not required to, but sometimes in certain cases, it seems reasonable, and it seems a reasonable accommodation, and that person will then have that waived. Personal services, a student requests that a university instructor adapt his or her teaching style to the student's individual learning style. That request would really be difficult and possibly would be considered very unreasonable, and so that request would probably be denied. And we already talked about tutoring. It's usually available, but not personal ones. Here's another one. Student has a chemical sensitivity disorder. Student requests that classmates and resident hallmates not to use perfumes, deodorants, and hair products while in the student's presence. This would be impossible to control. You know, how would we do this? There are so many factors here. So this is something that really would be impossible to enforce, and we could not do that. But on the other hand, it may be reasonable to grant the request of a student with a peanut allergy to have the dining hall label all foods that contain peanut products. Another direct threat. Students with blindness brings a guide dog to class. Another student in the class has a severe allergic reaction to dog hair. You need to accommodate both of them, right? And sometimes that's going to be hard. The allergic student makes an accommodation request to have the student removed from the class. What do you do? Well, you need to see if there's other alternatives. You know, can one student go to another section of the class? But what if it's a class where there's only one section? So these are going to be things that the administrators who make the big bucks are going to have to decide in the accommodation office, right? What may not be a reasonable accommodation, and these are two cases I've actually dealt with, and this is the fibromyalgia case. A student has fibromyalgia and suffers from it, and the student is going off to an off-campus educational site and is requesting a handicap parking slot at this, because she's going to be there for maybe a rotation and be there for maybe 3 months or something and wants a handicap parking slot. Well, she's never had a physician indicate that there should be a handicap parking spot. There's nothing official. The doctor has not approved it, so we have to deny it. You know, this person really doesn't need it. Actually, in this case, the physician said the student really needed to be walking, needed some exercise. So, in the second case, a student is unable to perform patient transfers or lifting due to strength issues. So this is really kind of the early onset of fibromyalgia for a student, and they're still getting accustomed and they haven't built up their strength. The physician says, you know, this OT student, I can't remember if it was OT or PT, so that's why I put it down here. Can't remember which group of students that this student came from, but the person needed strengthening exercises to be able to lift patient. And so one of the things that's required of somebody in PT, in nursing, in OT, is often to do transfers, patient transfers, and they have to have that skill and they have to have that strength. And so to do that, we may make a temporary accommodation, but they will need to do that to be able to graduate from the program. They will have to know how to transfer a patient and how to lift a patient. So a temporary accommodation was made for this student, and the student was able to do transfers, became competent in that. Now, hopefully, that person, when they go out in the workplace, they probably will not want to work in a situation where they're doing a lot of lifting. They probably want to choose their specialty in an area where they're not doing a lot of lifting. A student with a broken hand is unable to perform laboratory exercises. It may be, if they're a dental student, you know, you can't give them accommodations. They really need to heal and come back. So you can't really give them an accommodation. Maybe if they're in classroom settings, that would work, but sometimes you just can't make those accommodations. Pregnant student must have bed rest for the last 4 weeks of the semester. Well, that's easy if you have recorded video stream lectures in your classroom. We can easily do that, but some faculty may not. So it may mean that person has to take an incomplete. It may be that person has to take a leave. I don't know. We've had, in our school, we've had a number of students' pregnancies. We've had had twins, two with two sets of twins. So we've been able to accommodate students in most cases, but sometimes they've had to take a leave of absence. So it just depends on their situation. Student with non-contagious tuberculosis is prescribed medication that causes short-term memory loss. Well, you know, you may have to take that medication for 6, 7, 8 months, something like that. It may be that you can't continue in school. It may be that the accommodations that need to be made for this is just unreasonable. Faculty it's really an undue burden to do multiple tests, have multiple times of giving the student information because their short-term memory is not good. And it may be that you have to then say, you just have to take a leave of absence and you know, come back after you've taken the medication and now you're clear and you're fine.